Hi, my name is Vianette. I wanted to talk about an experience that I had with a neuropsychologist. I have seen a therapist in the past, and I do see a psychiatrist. The psychiatrist does prescribe me medications. It is for anxiety and for depression. But when I was seeing the therapist, she did recommend that I see a neuropsychologist. The reason was because she noticed that at times I would have difficulty with my speech. Sometimes I would pause, or sometimes I kind of would get stuck when I was speaking, or I had a difficult time expressing what I wanted to say. So she said that it would be a good idea that I see a neuropsychologist because a neuropsychologist can diagnose, of course, neurological disorders, but also autism. So the therapist thought I possibly could have autism. So I made an appointment with a neuropsychologist. The doctor and the provider, the name was Kemper and Associates, Neuropsychology Services. And so I did make an appointment. It was actually a long process. So it was a total of 4 appointments that I had to have. The first appointment was just an intake appointment over the phone. And the doctor asked me a lot of questions just related to my background and about just any kind of medical history or any kind of social tendencies and things like that. The second appointment was actually in the office, and it was a test that it was actually the neuropsychological test. This was 4 hours, it was very long. And they went through many tests. Some were designed to test memory, some were for vocabulary, some were for quantitative skills, like how well you could kind of do math in your head. It wasn't difficult problems, of course, but it just kind of tested to see how well you can solve problems in your head. It also tested visual spatial abilities. You would have to look at an image, and then they gave you a set of blocks. And with these blocks, you would have to recreate the image. And the way you would do that is because these blocks had kind of little drawings on them, and they were designed to look the same as the image. It's a little bit hard to explain, but pretty much it was like a puzzle. Each of these blocks had a kind of a piece of a drawing that was designed to create this bigger drawing. So with the blocks, you were supposed to recreate whatever was on the page. And yeah, so there were many tests. It was 4 hour long. It was, it was quite long. The third meeting that I did have, that also was in office. That one was a lot shorter. It was about an hour, 15 minutes. That one was specifically designed to diagnose autism. And so it was, that was the main reason for it. So the way that the appointment went is when I talked with the doctor, he just asked me many questions. It was many personal questions just about personal habits, social habits, different routines, things like that. And he did have me do a few tests, like hands-on tests that were designed to test creativity. So I did go through those tests. And again, that was 1 hour long. After that, I did answer a bunch of questions. It was about 200 questions that were just kind of personality tests. So it asked a lot of questions about mood, about emotional control, and things like that. So at the final meeting, that was the feedback, and it was over the phone with Dr. Kemper. And at this meeting, she told me the results. So what she did tell me was that during the test, I did show, which I kind of know, but she did tell me that they observed a little bit of awkwardness when I speak, and they noticed that I tend to pause a lot, and I tend to use a lot of gestures, hand gestures. Um, so they did notice that, but she said that they did note that I do appear to have a good grasp of social interaction. I use language well, um, in a normal way, and I don't seem to have any repetitive patterns or any kind of repetitive behaviors. Um, and just a small side note, one of the diagnoses for autism involves that a person exhibits some very repetitive behaviors, or for example, they will tend to line things up, like they'll have many coins and they'll tend to like to line them up, or they will tend to um, kind of, if they have, for example, if they have cans of food, like if it's a child and they have some cans of food, like they'll like to stack them up. Just many repetitive behaviors or fixations, like the person might fixate on a light or a sound or a texture. So Dr. Kemper, she did say that I don't have any of these repetitive behaviors or fixations, which is a big part of the diagnosis for autism. If you don't have that part, you cannot be diagnosed with autism. But one thing that she does want to still rule out is just the communication part. So some of the habits that I have, that they noted, she said that that is more similar to a diagnosis of someone that could have autism. So that's something she said they would want to just rule out and make sure that's not just a constant thing or disrupting my life. So, yeah, pretty much that is what she did tell me. It actually, she did go through um, the whole evaluation. So it was very long. It was about 5 pages. She did go through the whole thing. Actually, I did learn some surprising things. Um, for example, in there, um, it did talk about the test that I described, where you had to put the blocks together to form an image. So actually, in that test, I did not do very well. So that test indicates visuospatial abilities. So how well you can manipulate images in your mind and then like recreate them, or just kind of yeah, so recreate them or just kind of manipulate those images in your mind. So that was um, one thing that I had difficulty with. She didn't draw a lot of attention to it, but at the end, she gave me a lot of feedback of what to do from now. She said it will be good to talk with my psychiatrist, and just tell them, of course, about the feedback and ask whether there's any medication that I might need to adjust. She talked about going back again to see a therapist, that can be helpful, and not just individual therapy, but group therapy can help, and just any kind of social social situation or a kind of setting where I can do where I can kind of do more work on just the social aspect and interacting with other people. So that was my experience with the neuropsychological tests and with Dr. Kemper and Associates. And it really, I found that it was an interesting experience. It really was good to go and just have a formal, confirmed diagnosis, or I guess not a diagnosis, saying that I do not have autism, because this was a concern for my provider. But it did open my eyes to see that there are definitely some things that I do want to work on, and some things, and they did provide me with some tools and with some suggestions as to how I can do that. But thank you for your time, and I hope that this can help somebody that is possibly thinking of going with a neuropsychologist, or has a concern, or they have a question as to how an experience might be, like what the experience is like, or what it is like to go with a neuropsychologist. Thank you.